This segment of DelmarvaLife is brought to you by TidalHealth.
Well, for most women, making that yearly appointment with the OB/GYN is definitely not our favorite thing to do. Almost as uncomfortable is talking about all things gynecological, but it's critical to prioritize women's health. And Dr. Abha Gupta is an obstetrician and gynecologist with TidalHealth OB/GYN in Seaford, joining us this afternoon to talk about something that shouldn't be hard to talk about. Thank you for being here.
Thank you for having me.
So first of all, I want to talk about you a little bit. You are no stranger to Sussex County, are you?
I am not. I actually have been living in the Sussex County since 2005.
Wow.
Yes.
Yeah. So in the practice you have now with TidalHealth, let's talk about some of the more common things you see with patients.
Okay, so that's one thing I love about OB/GYN. It is truly womb to grave. So we see all age groups, starting as early as 12 years maybe, all the way down till the end of life.
Yeah.
So we start off with, initially sexual health, teaching young teenagers about safe sex, and then comes the family planning, and then pregnancy. And then as they go through their life, sometimes, they get problems, benign obstetrical and GYN problems that we take care of, fibroids. July is the Fibroid Awareness Month. There are a lot of women who suffer from fibroids, and they suffer silently, and we are there to help them. There's endometriosis, pelvic pain. It's a silent disease. A lot of people don't know about it, and they suffer through it, which is very, very sad. And sometimes patients have gone through numerous doctors before they find someone who can actually take care of that pain, which we do. And then, of course, you have, cancer screening, your pap smears, your mammograms. And then other issues, mental health, we definitely take care of that.
Really?
A lot of times, absolutely. You'll be surprised. A lot of patients don't have a primary care. We are it.
Yeah.
So when they come to us, we look at them as a whole. It's not just the female reproductive system, but we like to look at the patient and take care of them.
With all of this, all of the many things that you talked about, education is key, and that's a big part of your job, isn't it?
Absolutely.
Why is that?
So education is very important because you want to make the patient aware of her choices. That's the key point. It's central to her ability to make decisions and make choices that can then help her decide what she wants to do with her health. She has to make that decision. It is her choice, and she has to understand that. And to understand that, she needs to have the knowledge. And we want to empower those women by giving them that knowledge.
But also education as to there are solutions to what might feel uncomfortable, pain and things like that.
Absolutely, absolutely. And that's why it's very important for the patient to be honest with their physician, to tell them what's going on. And so then the patient, and then we can, go over the history and then say, hey, wait a second, this is not normal. Let's look into this. Let's find out what's going on. This is absolutely not normal. Let me help you.
One thing that's really neat about TidalHealth is the communication system that they set up, where patients can reach out to their healthcare providers. In my chart, do you use that?
Oh, absolutely. We encourage all our patients to use that. That is a wonderful, wonderful tool. They can get in touch with the doctor. Of course, it has to be a non-urgent question. They have to keep in mind, if it's an urgent question, it's better to pick up the phone, try to get in touch with the doctor, or just come to the hospital. They can look at their appointments. A lot of times, now before patients just say, oh, I didn't know. Now they have a tool. They can go and they can see when their appointment is up so they don't miss it. They can ask for refills. Very, very important. You're running out of medication, just send a message. Hey, I want a refill. It's so easy. And then you can look at your results. So you know what's going on with your life, with your labs and everything. And then if you have a question, then you again send a message to your provider and say, hey, I looked at these labs. Do I need to come in? Can we talk about it? So it's a wonderful tool, and people should use it, absolutely.
Well, it's wonderful that you're with TidalHealth, and thank you so much for coming in.
Thank you so much for having me.
Dr. Abha Gupta
Yes.
And you are with TidalHealth Seaford.
Correct.
Well, while we're on the topic of health, it's a great time to head over to Custom Fit 360 for this week's Trainer Tip Tuesday.
Hey everybody, we're here at Custom Fit 360 Lewis with another episode of Trainer Tip Tuesday. Last week we talked about never skipping your warm-up before a pickleball game. This week we're going to talk about how to train before we play to reduce the risk of getting a low back injury. It's one of the most common injuries on the pickleball court, and that all comes from stability and strength through our core and protecting our spine. So we've got David here who's going to show us a couple different exercises. So today, first thing he's going to do is a side plank. So you can do this on the floor, on your bed. Go ahead and lift the hips up. All right, it's going to have lateral strength and stability, help protect the spine. You're going to hold this for about 30 to 60 seconds depending on your current ability level, or maybe less and you just want to progress it. Let's go to a hip bridge. So the glutes and the lumbo-pelvic hip complex are going to be super important for not just pickleball, but everything we do in life. I think our posterior chain is something that's often quite neglected. Good. Let's do a dead bug. Feet up. You're going to raise and lengthen opposite arm to leg. You want to hold it, pause. Give me a good brace in there. Brace. Good. And then finally, we're going to do a bird dog. These are 4 great exercises. He's quick on the turn to be able to help strengthen and stabilize the core. Go ahead and turn that toe towards me, towards you. Pull that toe. There you go. Stabilize the spine, strengthen the spine, help reduce risk for injury. Visit us at www.customfit360de.com, and don't forget to tune in next Tuesday for another episode of Trainer Tips.